Eli's body snapped forward in the ER chair like someone had pulled a wire through his spine. "Help him," I screamed. His eyes rolled back, his hands clawed at the air, then he slid sideways, convulsing so hard the metal chair scraped across the floor. A nurse rushed over, but the doctor behind her barely looked up from his tablet. Dr. Kevin Leland glanced at my husband and said, "Has he taken anything tonight?" "No," I said. "He doesn't use drugs, he collapsed at work, he's been confused, his head." "Ma'am, step back. He's still seizing." Security moved toward me like I was the problem. Dr. Leland sighed. "Stress-induced episodes can look dramatic." Dramatic. That was the word he used, while my 25-year-old husband was choking on air in front of everyone. Eli suddenly went limp, then he vomited onto the floor. For 1 second, I thought the doctor would finally understand. Instead, he said, "We'll stabilize him, then you can take him home." My hands went cold. Before we continue, please hit the like button, subscribe to the channel, and turn on the notification bell for updates. They gave Eli medication, checked his vitals, and moved him behind a curtain. When I got close, his face was twitching on one side. "Eli," I whispered, "look at me." His eyes wandered past me. "Where are we?" "We're at the hospital." He blinked slowly. "Why is the room burning?" I turned to Dr. Leland. "Something is wrong, please can you do a scan?" His jaw tightened. "His vitals are stable. We don't order unnecessary imaging because family members are scared." I looked down at my shoes. Eli and I had lost our insurance 2 months earlier. Maybe he could see it on us, the cheap clothes, the exhausted faces, the fear of the bill. Then a nurse handed me discharge papers. "He can barely stand," I said. Dr. Leland didn't even look at me. "Take him home." I wrapped Eli's arm around my shoulder and guided him toward the exit. We made it 6 steps. Then Eli's knees buckled. His head hit the tile. His body started jerking again. An older doctor ran over, knelt beside him, checked his pupils, then picked up the chart from my shaking hands. His face changed. He turned toward Dr. Leland and said, "You discharged my patient." The entire ER went silent. Even the receptionist stopped typing. Dr. Leland straightened slowly. "Excuse me." The older doctor looked back down at Eli, who was convulsing against the floor hard enough to make his shoes squeak across the tile. "Get him into trauma now," the older doctor snapped. Everything changed instantly. The same nurses who had been avoiding eye contact suddenly rushed forward with a gurney. One of them pushed me aside gently as they lifted Eli. "BP dropping. Get neuro upstairs. Move." I stumbled after them, trying to keep up as they disappeared through double doors marked critical care. The older doctor finally looked at me directly. "I'm Dr. Alan Mercer, I'm head of neurology. Where has he been for the last hour?" I stared at him. "We've been here the whole time." His expression darkened. Behind us, Dr. Leland said, "He presented as non-emergent. No consult was requested." Dr. Mercer turned sharply. "Then why was I paged over abnormal blood work?" I froze. Abnormal blood work. Dr. Leland folded his arms. The symptoms were inconsistent. "Inconsistent," Mercer repeated. "The alert specifically recommended neurological review." For a second, nobody spoke. Then Eli screamed from inside the trauma room. Not words, just panic. I ran toward the sound. Inside, 3 nurses held him down while monitors shrieked beside the bed. Eli's eyes darted wildly around the room like he didn't recognize where he was. Then he looked directly at me. Except he didn't know who I was. "Sir, can you tell me her name?" a nurse asked him carefully. Eli stared at me blankly. My chest tightened. "Eli," I whispered, "it's me." He looked terrified. "Who are you?" I backed into the hallway before my knees gave out. 2 months earlier, we'd lost our insurance after Eli's campus job cut employee benefits. Since then, he'd ignored headaches, confusion, even moments where he forgot simple words. We kept telling ourselves it was stress because we couldn't afford another answer. Now I sat on the hospital floor realizing I had trusted the wrong person to decide whether my husband lived or died. Dr. Mercer crouched beside me. What symptoms did he have before tonight? I wiped my face. Headaches, bad ones. He said he smelled smoke sometimes when nothing was burning, and yesterday he forgot our apartment number. Mercer went completely still. Why wasn't any of that documented? I looked toward the trauma room. Nobody asked. Before he could respond, alarms exploded inside the room. A nurse burst through the doors. His brain pressure is spiking. Doctors sprinted past me so fast the air shifted around my face. One nurse nearly collided with Dr. Leland at the station. We need CT ready now. Dr. Mercer came out seconds later, already pulling gloves off his hands. Bring up the chart history. Dr. Leland lowered his voice. Alan, this isn't the place. The chart now. Patients in the waiting room had started watching openly. A man holding an ice pack stood up just to listen. 2 residents froze beside the medication cabinet. The hallway monitor lit up with Eli's records. Mercer pointed at the screen. There. A red notification sat in the center of the chart. Neurological alert, urgent review recommended. Time-stamped 42 minutes earlier. My stomach dropped. Mercer looked at Dr. Leland. You signed discharge after this triggered. Dr. Leland's face tightened. The ER is overloaded. I didn't personally see every automated alert. A senior nurse near the desk hesitated. Then quietly said, I told you about it. Everyone looked at her. She swallowed hard. I told you his confusion was getting worse. Dr. Leland snapped immediately. That's not what you said. It is. You're misremembering. The nurse's eyes lowered, but she didn't back down. Mercer stepped between them. Enough. For the first time since we arrived, I noticed how many staff members suddenly refused to meet each other's eyes. Like this argument had happened before. Mercer turned toward radiology. I want a stat brain scan immediately. A hospital administrator approached from the hallway. Dr. Mercer, we should discuss this before escalating. Escalating, Mercer barked. He's actively deteriorating. The administrator glanced at me, then lowered his voice. Risk management needs to be informed before. He may not survive long enough for your paperwork. They wheeled Eli past us toward imaging. His body looked terrifyingly still now. I followed until 2 residents stopped beside the vending machines ahead of me, whispering fast. They've been hammering admissions all month. I know. They said too many overnight neuro holds before the audit would kill the department metrics. I slowed. Audit. Metrics. This wasn't just one doctor making a bad call. The scan results came back less than 20 minutes later. I knew something was wrong before anyone spoke. Mercer stared at the images so long the room became silent around him. Then he turned toward me carefully. The inflammation is severe, he said. We're trying to stop permanent damage. My legs nearly gave out again. Across the hallway, Dr. Leland quietly grabbed his bag from beneath the station desk. He started walking toward the exit. Mercer saw him. Kevin. Dr. Leland stopped. Mercer's voice carried across the entire ER. Do not leave this hospital until risk management arrives. By midnight, the intensive care floor looked nothing like the ER downstairs. No shouting, no televisions. Just quiet footsteps, locked doors, and people speaking in whispers like someone had already died. Eli was on a ventilator. A nurse had explained the surgery 3 separate times before I understood any of it. They drilled into his skull to relieve pressure building around his brain. Now he lay motionless behind glass while machines breathed for him. I sat outside his room holding his wedding ring because they'd removed it before surgery. 2 administrators walked past me speaking too quietly at first. Chart access logs already pulled. Yes, but legal wants copies before neurology reviews everything. Legal. Not treatment, not recovery. Legal. Dr. Mercer came out of Eli's room still wearing surgical scrubs. He looked exhausted. "He made it through the procedure," he said. I stood up so fast the chair scraped backward. "Is he going to be okay?" Mercer paused too long before answering. "We intervened in time. If he'd gone home and fallen asleep," he exhaled slowly, "he likely wouldn't have survived the night." The hallway tilted around me. All I could picture was Eli trying to walk out those ER doors, while I carried discharge papers in my hand like they meant safety. A woman from risk management introduced herself an hour later and sat beside me with a folder. "I need you to tell me exactly what Dr. Leland said before discharge." I repeated everything I could remember. "He called them panic episodes." She wrote quickly. "He said resources were limited tonight." Another note. "He told me hospitals couldn't admit people without medical necessity." Her pen stopped moving for half a second. Meanwhile, inside a nearby office, Mercer reviewed electronic records with 2 administrators. I watched him point sharply at a computer screen. A nurse exiting the room muttered to another employee. He cleared the neuro alert himself. My chest tightened. Not ignored. Cleared. Minutes later, Mercer approached me again carrying printed paperwork. "We found something else," he said carefully. "Your husband's spinal fluid testing had already been flagged for possible viral encephalitis before discharge was signed." I stared at him. "You mean they knew?" "They had enough information to stop and investigate further." The pressure inside the hospital was changing now. Nurses whispered in corners. Phones rang constantly. Administrators kept shutting office doors the moment staff approached. But word was spreading anyway. One nurse quietly told me there had been previous complaints against Dr. Leland for dismissing serious symptoms too quickly. Then, just after 3 in the morning, Eli briefly woke up. I rushed into the room. His eyes opened weakly beneath the ICU lights. He looked confused, exhausted. "Martha," I grabbed his hand instantly. "I'm here." His voice barely worked. Why did the doctor want me to leave? I couldn't answer him. Outside the room, security escorted Dr. Leland down the hallway toward an administrative office, while staff members openly watched. Through the glass wall, I saw Mercer place chart logs onto the table in front of him. For the first time all night, Dr. Leland looked scared. Then the blinds slammed shut. 3 weeks later, I finally heard the full story. Not rumors, not whispers in hospital hallways. The actual truth. A hospital investigator sat across from me with a stack of printed reports, while Eli slept in a rehabilitation room down the hall. Dr. Leland was under administrative pressure to reduce unnecessary admissions, she said carefully, particularly neurological holds. I stared at her. She slid one of the reports across the table. Internal emails. Department metrics. Performance reviews tied to hospital funding. Executive bonuses connected to ER turnover rates. The investigator continued. Multiple physicians were encouraged to avoid specialist escalation unless absolutely necessary. But Eli was seizing, I said. She lowered her eyes slightly. Yes. I looked at the report again. Dr. Leland had seen the neurological alert. He had opened the lab results. He had reviewed the recommendation for urgent evaluation. And he still signed the discharge papers before all testing returned. Not because he missed it. Because he decided not to stop. Dr. Mercer explained the rest later that afternoon. Eli had viral encephalitis, he said. The infection caused swelling throughout the brain. Every hour without treatment increased the risk of permanent damage. I sat beside Eli's bed after Mercer left, staring at the bruises still fadding from surgery. For days, I couldn't stop replaying that moment in the ER. Take him home. I had almost listened. Eli's recovery was slow. At first, he forgot simple words halfway through sentences. Some mornings he struggled to remember what day it was. He had to relearn routines he used to do automatically. I helped him practice reading from restaurant menus. We walked hospital hallways together while he steadied himself against my arm. Sometimes he'd stop suddenly and look embarrassed after forgetting a word. I'd squeeze his hand and wait until he found it again. Meanwhile, the hospital began unraveling publicly. Several nurses officially testified that complaints about Dr. Leland had been ignored for months because administration prioritized patient flow numbers over caution. Then someone leaked the records. Within days, local news stations were running headlines about a seizing patient, nearly discharged despite emergency neurological alerts. People protested outside the hospital entrance. Former patients came forward with their own stories. Dr. Leland's medical license was suspended pending investigation. The hospital quietly settled with us before the case reached court, but the damage was already done. Administrators resigned after internal emails became public. Mercer became the face of new policy reforms, requiring secondary review before neurological discharges. And somehow, the person who had once stood shaking in that ER lobby became the witness investigators relied on most. Months later, Eli walked into his final neurology appointment on his own. Slowly, carefully, but on his own. Dr. Mercer reviewed the scans, then leaned back in his chair. "You were about 15 minutes away from a very different outcome," he said quietly. On the way out, I passed the same ER desk where Dr. Leland had dismissed us that night. The chair behind it was empty. I stopped there for a second, remembering Eli collapsing near those exit doors. Everyone thought that moment was the disaster. But it was the only reason my husband survived. The doctor who told me to take him home lost everything the moment someone finally asked the question he couldn't answer.